Lowering the number of COVID patients is the top priority in this state and all around the country. But there's an entire group of people suffering weeks, months, and sometimes over a year after getting COVID.
We're almost forgetting about the people that have already had COVID and still have these awful symptoms that can change their whole lives.
As Kristen Goodwillie reports, the symptoms people experience not showing up on most medical screenings, and it's leaving the medical community with many questions.
It's like Russian roulette.
I feel prisoner to my own body.
You get COVID-19 and survive.
It's terrifying when you really think about that this could be the rest of my life.
But then weeks go by.
I'm still dealing with side effects or symptoms of it.
And you're getting weird, sometimes debilitating symptoms.
A lot of things I taste like spoiled.
The heart palpitations were the scariest.
My hand kept shaking and I was like, how is this gonna go away? And nobody seemed to know.
You're just keeping it straight in front of you?
Penny McCurdy worked in the COVID unit at the VA hospital during the height of the pandemic until she got the disease November of 2020.
Keep your eyes on that X.
After the 10th day, I wasn't in the hospital. I should be getting better, and I was not.
Almost a year later.
What about the pace change?
Yes.
Did that make it worse? Okay.
She's still getting treatment for long COVID symptoms.
It's been debilitating physically and psychologically.
McCurdy hasn't been able to go back to work and has been diagnosed with PTSD from the myriad of problems she's had since having COVID.
What would you say your quality of life is right now?
I don't like it. It's not good.
Her vision has changed. Fatigue is a constant and the brain fog significant.
It's almost like their brain short circuits and they have difficulty organizing the thoughts.
The many different symptoms affect all parts of the body. Norton Healthcare has created both a brain fog and long COVID clinic to help those in Kentucky and southern Indiana.
I'm an old ICU nurse, so I used to fix things, and now I try to fix things.
Candace Gray Cunningham only sees long COVID patients. The way they treat them hasn't changed much since the pandemic began.
I say I don't know a lot during the day with my patients.
People come in feeling off, but all of their labs, head imaging, chest imaging come back normal.
Is it possible that there are tests that we don't even have to figure out what is wrong?
I hope so. I hope that we do learn how to test for this.
An inherently invisible illness, it can feel isolating.
I left validated that it wasn't all in my head. It was real, and it was really happening.
As people like Carmen, who live and breathe a fast-paced theater life, finds herself forced to slow down.
You can pause if you need to.
Yeah, let me catch my breath. The walking and the stairs and the talking was a lot.
It's been 8 months since she got COVID. Over a year and a half for Robert Moss.
I have a lot of support from my family, and I talk to a lot of people online about it too. That's where I learned out like other people are having side effects.
Facing the unknown, many are turning to social media groups, comparing side effects and possible solutions. According to every doctor we've talked with, the progress is slow.
Turn to the right.
Time and therapy are the best solutions.
Good.
You don't have a clue what's going to happen tomorrow, or next week, or next month, or next year. You just have to wait.
As the weeks tick by,
I do think that most people will get well. I think there's a small percentage of people who will continue to have lifelong symptoms.
it's a waiting game.
It would be easy to just say, I'm done, but you just have to keep going.
And though clear answers aren't available,
I've had lots of patients, they return to work, they return to what they feel like is their normal.
realizing that others are going through the same thing between doctors and patients.
I don't give up. I'm pretty hopeful.
I see a light at the end of the tunnel, a little bit, as before I did not.
There is hope.
Good.
For WHAS 11 News, I'm Kristen Goodwillie.
Very good.
On your side.